is Sabrina. I'm a pharmacy intern here to help you with your medications today. Can I just have you confirm your date of birth?
Yeah, it's March 30th, 1990.
Okay. And I see that you're concerned about the doctor wanting to increase your insulin dose. You're unable to control your blood sugar. Can you tell me more about this?
Yeah, I have type 2 diabetes and the doctor wants to increase my Lantus dose, but my sugars are still so high and I'm worried that the Lantus isn't working. I'm not seeing any improvement.
Oh, okay. Are you experiencing any problems lately?
Yeah, I'm having to go to the bathroom and urinate all the time. I'm always thirsty. I feel like I'm always hungry.
Okay. Have you changed the way that you're taking any of your medications, such as your hydrochlorothiazide?
No, I'm taking that the same way that I've been taking it for the past 5 years. I'm taking it once in the morning.
Okay, and how are you taking your Lantus?
I take it 10 units at night right before bed.
Okay, and can you show me how you take that?
Yeah, I drew up 10 units of the Lantus and then I just squirt it like this.
Okay, so I think I found out why your insulin dose may not be working for you. Let me show you a new way and maybe we won't have to increase your dose today. So, first we'll have your insulin, some alcohol swabs, the syringe, sharps container, and now first we're going to make sure you clean off the top of your insulin vial. And then you'll take your syringe and you're using 10 units at night. So first we're just going to put in 10 units of air. And this should have dried by now. And we're going to push that air back in the vial. And draw up the 10 units. So you just want to make sure that there's no air bubbles and that you're right at the 10 units. So instead of using your mouth, we're actually going to inject it into a different spot, and I will show you how. Now if you look at this picture, there's a couple different spots that you can use. Now one of which is your back upper arm, the side of your thigh, your upper hip, or on your abdomen right here. So once you pick a site that you're comfortable with, we're going to start back here. So you have your 10 units and your syringe, and once you pick that spot, you're going to take a new alcohol swab, and you're going to swab that site, and you're going to do it, start from the center of the spot and move outward in a circular motion. And you're going to let it air dry. And then you're going to lightly pinch the skin, and you're going to take your syringe and insert it at a 90-degree angle, so straight in there. And so you're actually going to put the needle into your skin, and you're going to slowly inject the medication, and the whole time you're keeping your fingers pinched. And you're going to hold it here for 10 seconds, so just count to 10 in your head, and then you're going to be able to take out the needle and dispose of it in the sharps container. Can I just have you show me what to do, so I know that when you go home today that hopefully your insulin will start working for you?
Yeah, I can. So I have my alcohol swabs and my insulin and needle, and I'm just going to open this up and swab the top of the vial and let that air dry. And then I'm going to uncup. And then I'm going to draw up my 10 units. And put the 10 units into the vial. And then I'm going to draw up my 10 units and make sure there aren't any air bubbles. And then I'm going to swab the injection site, starting from the inside and going to the outside in a circular motion.
Now, did you decide what spot that you wanted to pick?
I was going to go with the abdomen.
Okay, perfect.
So then I would go with there, and then I would swab the area, and then lightly pinch it, and insert the syringe at a 90-degree angle, and slowly inject the medication, and then I'm done, right?
So it was perfect, but just make sure that you pull out after 10 seconds.
Okay.
Okay, great. So I don't think that we'll have to increase your Lantus dose. As long as you follow those new directions, let me just call the doctor to run it by him to make sure that that's okay. Hi, this is Sabrina, the pharmacy intern. I was wondering if the doctor was there and if you had a couple minutes to talk about our patient Mac.
Yeah, Mac, date of birth 3/30/90. I was going to increase his Lantus dose.
Hi, doctor. Mac is here today complaining of polydipsia, polyuria, and polyphagia. He states that he has not changed his hydrochlorothiazide therapy at all, and he was worried about his insulin dose being increased and that it hasn't shown any improvement thus far. So he came in for a consult with me. Now, I found out that due to oral administration of the Lantus rather than subcutaneous, my assessment is that he was failing to receive his medication therapy appropriately. Now, I have informed Mac of the proper administration technique and recommend maintaining the current dose of 10 units of the Lantus subcutaneously at bedtime and following up to see any changes in his blood glucose control in the near future. Now, the patient, Mac, will monitor levels at home 3 times a day, and he's going to keep a diary of his glucose levels, and he's going to bring that in at his next visit.
Yeah, sounds good. Also have him check his blood glucose 4 times a day.
Okay, great. Thank you. Bye. Oh, Mac, the doctor has decided to keep you at your normal dose of your Lantus, so you're going to continue with the 10 units subcutaneously at bedtime as long as you follow the procedure that you learned here today. Now, also, he would like you to test your blood sugar 4 times a day, and I would like you to keep a diary and write all those values down and follow up in about a week. So you can make an appointment for about a week, and we'll review how you're doing then. And I think that's about it. Did you have any other questions before you go?
No, I'm just so glad that I don't have to increase my dose. It sounds perfect. You're a very good teacher.
I'm happy that we got this result today.
Thank you.
Hi, Matt.
Alright, so I got 10 units of the Lantus, and then I just squirt it like this.